We got a question about kratom use. Recently, it's exploded here in the US. It's something that's been used frequently in Southeast Asia for a long time. It's a tea extract or an herbal extract in the Western world. Dosing will be a lot different because they may take it as a pill, a powder, and they may get a much higher amount. Kratom has a lot of variability based off of what the amount is that you're taking. If someone takes a very low dose of kratom, it tends to be more stimulating, closer to coffee. It's a little bit energizing. If you take a higher dose of kratom, it acts much closer to an opioid, pain relief, it's calming, it's sedating, slowing people down. In the US, what we'll see a lot more of is higher dosing of kratom. It'll have partial agonist, which means it's kind of similar to Suboxone. It has some similarities in that it will act on that opioid system, but only partially. Heroin's going to hit the opioid and give you 100 stimulation. Kratom will hit that same place, that opioid, but give you a 60% stimulation. So it acts at the same place, but less stimulation on it. There's a lot of reasons that people take kratom. Even if there's not scientific evidence to really support that use, people will talk about kratom in this world of nutraceuticals or herbs or extracts where theory sometimes pervades evidence. There's three areas that I want people to think about when we're learning about a new substance. One is how much we know versus don't know. The mechanism, we haven't studied it extensively. We don't know a lot about it. There have been some overdose deaths reported in like poison control, which is scary. Caution, I think, considering there's so much we don't know. The second thing is that these kind of substances can interact with anything else someone's taking. That could then be dangerous when you mix alcohol or mix benzodiazepines or mix other opioids with it. You may be putting the respiratory depression at risk. We do know there's some risks of how it affects metabolism that may actually really significantly increase the level of the medications you're taking. The third thing is always look at it functionally in someone's life. Look at how kratom is impacting you. People typically make the mistake of looking at it in a short time frame. What frequently happens with substances that are not helpful for us is there's a bump, a short-term benefit we get from it at the beginning. So a lot of people may say, I feel a little bit better. When I take it, may actually be seeing signs of dependence. Instead of that actually helping with their depression, actually helping with their anxiety, is they've now become dependent and they get anxious, they get depressed when their body needs that chemical.